You jibber jab, bamboozle, nooka noozle, bippity bop, she-gall. You jibber jab, bamboozle, nooka noozle, bippity bop, she-gall. I mean, you keep on talking, but you don't know where to turn it off.
Welcome to the weekend. I'm Jon Caldara, president of the Independence Institute. You're watching Independent Thinking. This is a show I've been wanting to do for a long time. Medical marijuana has finally made it into its own so much here in Colorado. It looks like it's time to regulate. First of all, Rob Corry, who for, oh my God, a decade that I've known you, this has been your preeminent issue, medical marijuana. You were supportive of the law being proposed on the initiative, what was it, 2001, 2002? 2000. So it's been nearly a decade you've been working on this, and you've really built this into a well-paying career. But when you started off, you were a lone wolf.
I've paid my dues. I've spent many hundreds of hours in courts working for low pay or no pay on rigorous, tough
So now you're going
cases.
to become the Frank Azar of medical marijuana, is that right? Lots of rings on the finger. And there's only one man standing in your way. Senator Chris Romer, thank you for being here. You've got a bill that you're going to be putting forward this session to regulate the dispensaries and medical marijuana business.
Probably one of about 5 bills. I predict there'll be 5 bills in the legislation, but I've got the one that's come above the surface first. Okay,
let's lay the groundwork here and bring everyone up to speed. In 2000, we passed a law for medical marijuana to be legal here in Colorado. It was a somewhat vague bill in a way, in that there wasn't a whole lot of regulation. The law enforcement tried to shut this down for the first several years of it. Not only the feds, but also the state and also localities, keeping you busy. You've come on this show many times with medical marijuana patients. And long story short, the courts have certified that the law is the law, and here in Colorado, if you want to have medical marijuana and you're on the registry and you've been placed on it by a physician, it's legal. Did I encapsulate that?
That's
pretty
about
quickly?
right. And you know, most of the problems came about when people were prosecuted criminally. Law enforcement was trying to land these people in prison for medicating their debilitating conditions with marijuana as the voters intended. So they were trying to shut it down for years, and luckily there were a few hiccups along the way, but for the most part we've emerged with a fairly intact constitutional right.
And also you've got a sympathetic president who's saying we're not going to enforce the federal laws here in Colorado against medical marijuana, roughly. So right now it's open season. You guys can sell and be open, and your clients aren't being harassed as much as they were. I'm talking the end patients.
True. Freedom is happening.
Freedom is happening. Over here, you voted for this.
I did.
Back in 2000. Why did you vote for it?
I voted for it because I thought that it was medicinal, and I thought there were certain people, particularly cancer patients, who would benefit it. At the time, it was rumored to be quite good for people with nausea, and I thought it was a good opportunity to do something of value, something that's was compassionate. So I voted because I thought there'd be people who would benefit from it.
And would you agree people have benefited from it?
Absolutely. In fact, now the American Medical Association has voted to take it away as being a Schedule I drug to Schedule II, so we finally can get some evidence-based research on it. And the AMA has now stated that medical marijuana has evidence-based medicinal value for the treatment of lymphoma and a few other chronic diseases.
All right, so in other words, you haven't changed your point of view. You're not looking to stop the sale of medical marijuana.
No.
I want to stake that out first.
Yep.
You support the honest use of medical marijuana. You want to regulate it.
Correct. I want to bring it out of the shadows, out of the underground position that it was in. I want to do exactly what President Obama did, which is a wonderful thing. Are we going to believe in states' rights? The states have been great places for experiments.
Because Obama's been such a big friend of states' rights.
Well, we can debate that, but on this issue, he's allowed us to go experiment. We're the
He's been kind of Thomas Jefferson of state rights. Yeah.
Thanks to Rob and others, we're the only state that's put it in the Constitution. So I do think that we have a public policy obligation to get it right. Now, where we turn the dial between the free-for-all versus the plan to shove it back underground, that's where I lie. I lie in the middle, which is a medical model that's more clinical than retail, but a lot of people don't agree with me in that subtle difference.
Let's get to that in a second, though. Let's bring us up to speed. So now that it's easier to sell medical marijuana, that basically you've won now over 9 hard-fought years to make sure that people have the right to buy and sell this. Is it too easy to do? You said that there are, what, 300 now medical marijuana dispensaries? They're doing television ads. And if I recall, a disproportionate number of medical marijuana registers have come from just a handful of doctors. Isn't something? What's the number? The number they use is one doctor has given out almost a majority of the medical.
The number I hear is there's over 1,000 doctors in Colorado that have recommended medical marijuana to patients. So, to answer your question, though, it is not too easy for patients to get marijuana. It's still too expensive. It's still too inaccessible. There are still way too many restrictions on it. And for the most part, and unfortunately, the most vulnerable, hurting, the sickest patients of all of them have the hardest time getting access to their medicine. And that's because of government.
But it's easier now than it has been in 9 years. Can we agree on that?
I think we can, although the prices have really not decreased significantly at all over that time period. I mean,
having not been in the market, what's the price for an ounce of medical marijuana?
You're looking anywhere from $250 for the lowest to $600 or $700 to the best. Okay. You know,
we're now in a situation where localities are getting concerned. So that, for instance, in Centennial recently, the city of Centennial said, we don't want any more of these dispensaries. We don't want any. We're going to have a moratorium.
They had an outright ban.
An outright ban. The city of Denver is now looking at regulating it.
Licensing.
Right. Charlie Brown says, let's make sure they're not too close together. So in other words, we can't have any of that economies of agglomeration. We can't have shopping together. And it's okay for car dealers and restaurants to be in close proximity, but
and bars
and
liquor stores,
but not
and pharmacies,
not these other dealers. So let me ask you this: how much abuse do we have in the current system? When I say abuse, I mean recreational users who are using this system to buy the recreational weed they want. Let's go over here.
Sure. You know, I don't know for sure. I have been told anecdotally by the health department, and I'm hoping that they'll be an honest broker. They've had some issues in their execution of this, which has left my confidence a little shaken. I think they need to become an honest broker. They need to really open up without obviously violating the privacy rights of those people.
When you say honest broker, you're talking about a dispensary.
Honest brokers on who's on that registry, because that's the key issue to the uneasiness about how many 20-somethings with back pain got their card through a doctor process that wasn't a complete physical review.
But right now, if I do have back pain, if I wanted to try medical marijuana, and if I got it, they could sell it to me. I could buy it. And so if the 20-year-old has the card, isn't the problem that the doctor gave it to him? Why beat up on the dispensary for what is a legal sale?
John, you're right, and that's the first part of the bill that I believe it or not, I don't know if Rob agrees with this, but the portion relating to the doctor-patient relationship.
I disagree with about 99% of
okay.
it, just for the record.
Well, I'm sure you do. But at least between law enforcement and some of the groups that I've been working with, there is an agreement that there has to be a little tighter control. An example would be that we would sever the relationship that a dispensary would no longer be able to pay a doctor to write a referral. We don't do that anywhere else in medical world, where effectively the person writing the referral can be paid by the person selling it.
Except for every single hospital that has a pharmacy in it. You can get a doctor's recommendation or a doctor's prescription and pick up your pharmaceutical drugs in the same building, under the same roof, where the doctor is paid by the same hospital as the pharmacy.
But they can't be paid a referral fee. So it's the severing of the incentive to write the referral, because a referral ought to be based upon the honest evaluation of the condition, not a financial incentive to write it. And so that's one of the major parts of the bill, is to change that. And in fact, that's the one part of the bill that I'm pretty confident we'll get that part done, because most everybody in the building agrees about that. Where the disagreement breaks down is whether there should or should not be physical locations. My belief is there should.
What do you mean physical locations?
Dispensaries.
Why shouldn't there be physical locations of dispensaries? If I'm looking to get medical marijuana, where am I to get it?
My belief is that there should be locations. I personally would like them more clinical than retail, and I'll explain that in a minute. We do have a law enforcement group who has a bill that would basically eliminate all dispensaries and all physical locations. And that's where I'm pulled between a group who wants to continue what I call the Wild West, which is no regulation, versus a group who wants to literally just turn the clock back a year and pretend there are only 2,000 people who want medical marijuana.
Bring it over here. Right now we've got, what, 300 or so dispensaries.